All right, guys. So the study I've got for this week is looking at periodized resistance training in older adults. So looking at the characteristics of these subjects, we see that they're all in their 60s. Looking at the pre and post numbers, we see that their body weight actually doesn't change all that much from pre to post in either group. Height, body fat percentage, all stay about the same. Um, so that's kind of an interesting thing that we'll kind of touch on in the discussion, but just one thing to highlight about this study. So what had happened was the subjects came in, did their pre-testing, so I did a 1 rep max, followed, and I think it was given there like a 10 or 15 minute break, and then did a muscular endurance test, and then followed it up with a 6 minute walk. After that, depending on their baseline testing numbers, they were given 85% of their 1 rep max for what was considered a muscular strength day. So they did 3x6, and then given a couple of days rest, and then they performed a muscular endurance day, 3x12, with just a little bit lighter of a load. So there was 2 days a week for 10 weeks, and then they completed some post-test training using the same kind of protocol. So just taking a look here, looking at the strength side of things, we got the 1 rep max for the leg press and chest press. And we see across the board, we notice there are, at the very least, improvements, modest improvements, some kind of stagnant results. There was a couple of, outliers in the group where you see these giant increases in strength, but for the most part, a consistent trend. And we could see the same thing with the volume load on the leg press. So looking at this study, what they had kind of looked at was, manipulating the volume and load may be even more important in older adults than it is with, athletes or younger populations, just to minimize any risks of overtraining, which can severely impact this population group. And even with this population group, low to moderate loads can be beneficial for at least muscle building to prevent any sarcopenia or muscle wasting from taking place. And then piggybacking off of that is less frequent training provides more than enough stimuli for adaptations to take place. Some things that they kind of talked about was what would a longer study look like. This was only 10 weeks, and they kind of thought that had it gone longer from 12 to maybe 16, they could see sort of a bigger, more variance between the results. And then another one, so this population was trained, which is not really common to see for these kinds of studies. Usually when you get into the older populations, from the work that I've read, it's a lot of untrained individuals. So that was kind of interesting to see what a study looked like with trained individuals. And that was just defined as they were moderately active within 6 months of the study taking place. And what we had kind of talked about earlier with the body weight and body fat percentage, with this population, sarcopenia is such a big problem that even seeing things stay the same, while may not be, the best news, it's still good news because we can see that they're not wasting away within those 10 weeks. And again, it's 10 weeks. It's a pretty short study, so that longer study could give a little more insight into that. One thing that I thought was pretty interesting was there wasn't a change in their 6 minute walk times, or a significant change, so that they hypothesized that more aerobic training would be more impactful on that testing variable, and not really anything to do with the muscle side of things. So that's that.